I'm Drew David Brzezinski, a master's level therapist. So essentially my journey in behavioral health kind of started at a really young age. I guess you could say I was somewhat kind of ordained into this field, through my childhood trauma and childhood experiences. I was born to and raised by a single sick mother. I never knew my dad. Had no brothers or sisters. She was in the military, and then, after the military, just kind of worked as a bartender. When I was about 9 years old, she was diagnosed with Hodgkin's disease, and interstitial lung fibrosis. She was given 5 years to live. So in that moment, when the doctor kind of told her that, she had prayed just to be able to see me graduate high school, because no one in our family ever had. So that was kind of her prayer, just to see me graduate. So fast forward, her health continued to deteriorate throughout, my childhood years and into my teen and adolescent years. I remember just kind of, spending days and nights at, Moffitt Cancer Center in Tampa, and prior to that, Hershey Cancer Center in Pennsylvania before we moved to Florida. Doing everything I could to take care of her. I started working when I was 13 years old to be able to pay for my own clothes, things I wanted, surfboards, CDs, whatever it was that I wanted, I kind of had to get on my own. And during this time, she had a really hard time coping with her medical diagnosis. In addition, she already had a diagnosis of PTSD. She endured a lot of physical abuse as a child, which then translated into, her adulthood, as she had like a really bad picker for men. I saw a lot of and experienced a lot of physical abuse, verbal abuse, emotional abuse, psychological abuse at the hands of some of her choices in men. And during this time, she started to drink pretty heavily. I was introduced to alcohol at a pretty young age. I was 13, working in a restaurant, a little local restaurant in, our hometown, where if you wore your job shirt to the little bar next door, you pretty much get served. And, my mom really modeled that maladaptive coping for me. So kind of fast forward some more, my mom did get to see me graduate high school. So I graduated in 2000 and immediately moved to Orlando to go to school, explore college. And, so she got her prayer. She got to see her son graduate high school. Very shortly after that, I dropped out of school and started bartending, kind of following in her footsteps. And we got into a pretty bad argument. She wasn't very happy with my choices. Told her, I took care of you my whole life. You don't like my choices, you can, kick rocks, to put it nicely. Didn't talk for a couple days, and she died 3 days later. So that was kind of like where I began to experience a lot of guilt and shame, just kind of our last conversation ending the way that it did, and me saying the things that I said that I'm sure were extremely hurtful, and not getting the opportunity to really, apologize or, tell her I loved her. So after she died, I was bartender, so I kind of just, that modeling of maladaptive coping came back, and I really just kind of started coping through excessive drinking. A little bit after that, my grandmother passed away, and my grandfather passed away, all within the same few months. So I just kind of lost it. Just drinking, fighting, being in the bars late night, just really, just self-deteriorating, essentially, just kind of falling apart mentally and emotionally, just complete self-destruction. And around that time, I had caught some charges that, were potentially resulting in some pretty significant prison time. I ended up getting an attorney here locally, an attorney that I now work with very closely and has become a very close colleague, who really just kind of saw potential in me and encouraged me to do some sort of mental health treatment. I was out surfing one day, and I was just kind of like, what do I want in life? And I knew all I wanted was to be a good father and a good husband. And I knew that if I just took a plea or, did community control like here in this area, that I'd keep bartending and continue to self-destruct, and ultimately that would never, be accomplished. Made the decision to go to a Department of Corrections funded year-long treatment program in Ocala. And while I was there, it was really funny because my therapist used the word alcoholic. And I just looked at him and I was like, I'm not an alcoholic. And he's like, well, you're in severe denial. You know, he's like, what would you know, you're here for DUIs. Like what else, you know? So essentially, you know, I was like, listen, man, I've never had like an issue with alcohol. Like I have trauma, I have depression, I hate myself, like self-harm, guilt, shame, you know, and those are the things that have led me to self-destruct. And alcohol is just a byproduct of that. In that moment, he completely changed his affect and just, you know, for the rest of my time there, you know, he said, what do you want to work on? And I said, I want to work on my mental health. Like, I want to learn to love myself again. I want to not be depressed. I want to forgive myself. You know, I want to live a happy, healthy, emotionally and mentally sound, productive life. From that time on, he worked with me from that perspective. So he never mentioned the word alcoholic, addict. You know, we talked about trauma. We talked about, you know, the 7 stages of grief. We talked about what comes along with depression and maladaptive coping, and, you know, and how community affects our lives and having good people around you. And that all really resonated with me. So, you know, I continued to work on those things. And when I completed treatment there, I ended up staying in that area. And while I was in treatment, I started going to school at the local community college. If you had a high school diploma, they had a program where you could go into the local community college. So I started working on my associates in psychology. When I got out, I decided to stay in that area and continue with school. Graduated with an AA in psychology and was applying to St. Leo University for a bachelor's in psychology and human services. During that time, I was just wrapping up some probation, ended up coming home to see, you know, some people that are the closest I have to family, and ended up catching a technical violation of probation for being out of the county without permission. You know, stayed in jail on no bond and went to court. The state wanted 5 years prison, and I was like, nope. Fired my attorney and just, you know, begged the judge for mercy, and the judge ultimately said, you know, you come a long way, but you still don't know how to follow directions. So he said, I think 5 years is a little excessive for everything that you've accomplished, but I'm gonna order you to a year and a day in the Florida Department of Corrections, where you will either go and, you know, continue down the path you're on, and I'll see you back here again, and next time I will sentence you for 5 years, or you'll go, you'll get your game time, you'll get out as quick as possible, and you'll go right back to the good you were doing. And maybe I'll see you in another capacity someday. Right then I was like, well, run it, you know, so went and did a year, 9.5 months on a year in the Florida Department of Corrections prison system. Got out, went right back to school, completed a bachelor's in psychology and a bachelor's in human services. For my bachelor's in human services, I needed an internship, and I was so, you know, my felony was so close to the internship that it impacted me still. So I called, you know, the facility that I went to, and my old counselor had become the clinical director. So he remembered me and he said, hey, come up, fill out an application, we'll see if we can get you in. So they were able to kind of push me through, and I started, you know, my internship with the Phoenix House in Ocala. And then 2 weeks before graduating with my bachelor's, they hired me on as a bachelor's level therapist in their self-pay insurance funded unit. I mean, what really drew me to this field was my own experience with my own mental health and family systems challenges growing up, in addition to my experiences with friends and acquaintances in the community. You know, so that really drove me to want to be the change. You know, my own stories really equipped me to be the therapist and helper that I am, in the way that I've fucking been there. Like, I know what works and what doesn't. I know how people want to be treated and how they don't want to be treated. And really just applying that to my craft. Like, you know, we don't treat patients as just, you know, anyone. We don't throw around diagnoses. We don't, you know, just have some protocol of recommendations we make. Like, we work from a patient-centered perspective. It helped us to develop a collaborative perspective here at Beachside of, you know, supporting all pathways to recovery. You know, we support mental health-based recovery. We support abstinence-based recovery. We support medication-assisted treatment. We support moderation-based recovery because there is evidence behind every single one, and this is not a cookie cutter process.